This is Judy Herman, advocate for authentic humanity, counselor, and author of Beyond Messy Relationships. You are listening to #POD podcasts of dentistry with Dr. Panks.
podcastofdentistry.com/squadcast. I believe everyone has a story to tell. And if you want to start a podcast to tell your story, the easiest way to start one is Squadcast. No special hardwares, no special softwares needed for you or your guests. You simply start podcasting using any laptop or desktop or Android phone and even a Chromebook in a browser like Chrome, Firefox, Opera, Brave. So, you may ask, how did you do it? Well, it's simple. As a host, you simply schedule an interview on your dashboard. Share that particular link to the guest and hit record to get studio quality audio. Done. No sign-ups needed by your guests, no special mics needed by anyone, and still get studio quality audio. There can be up to 4 people at one time, including the host. You can even see the video of your guests. Connect any earphone or headphones with mic and you're golden. When you're done, simply stop recording and everything with separate tracks is automatically uploaded on your dashboard, ready to download in no time. Most of the basic audio editing is also automatically done when you download. Do I not make any sense? Well, they do have demo videos on their website to show you exactly how it is done. I did use the support and they have best in the class support. They are so confident in their services that they have even compared their services with other competitors. Another thing that gives me peace of mind is redundancy. That means that even if there is some error, you can still get the backup of all the recordings sent to you in your email through your dashboard. So, if you really like the idea of starting your own podcast, podcastofdentistry.com/squadcast. The subscription starts only at $10 per month. You can cancel anytime through your account without making any calls or any change of emails. Super easy. Once again, to support this show, simply go to podcastofdentistry.com/squadcast. Give it a try.
Today, we have a very special guest who is not only a dentist, but an author, a certified professional coactive coach, and a business consultant. She is Dr. Bita Saleh. Today, we'll talk about what the guest calls it as the Fearless Way method, and I was referring to it in the podcast as the Well-Referred Dentist method. The book by the same name, The Well-Referred Dentist by Dr. Bita Saleh. To understand what we talk today, please keep an open mind and a little patience. It certainly gets easier to understand as we move forward. I would agree that it is a pretty dense podcast embarking on energy psychology, dreams, intuition, fears, anxiety, limiting beliefs, and so on. We go in detail about this matter and discuss the veracity, usefulness, both in a left brain statistical kind of a way and the right brain imagination kind of a way. You would probably have to read her book to get the full understanding, but I think I've done enough work for you and I try to ask all the questions that my audience might ask. We talked about implementing this method in your own office, what to do, how to do it, and of course, its usefulness. As usual, Tim Ferriss Inspired Questions brings out the hidden gems about the guest and the process, of course. We talked about TM, her morning ritual. What other changes did she observe by doing TM for all these years, and so on. It is indeed a different kind of a podcast since it tries to expand your horizon in a very powerful way. There is some food for thought and indeed some fun moments. I was not sure if I would be able to ask relevant questions, but she's an empath and at the end, it was indeed a rewarding experience. Please enjoy Dr. Bita Saleh from Well Referred Dentist. As usual, all links and podcasts are available at podcastofdentistry.com/session23 and podcastofdentistry.com/Bita. So without further ado, Dr. Bita Saleh.
Welcome to Podcast of Dentistry, #POD. And I don't want to bore with all the intros and all those things. Let's dive into it, right?
Okay.
I know the topic we are discussing is a little new, so we all have to keep an open mind. To start with that thought process, I think, let's say you want to talk about the phrase you used in your book, teacher of the heart.
Yeah, that's a great question, Dr. Panks. Teacher of the Heart is about loving the individual patient who presents to our office in whatever form they present themselves that moment. And really, truly seeing them beyond the fear and anxiety that they're presenting. Maybe that fear and anxiety is presenting itself as frustration or anger or complaining or saying, why isn't my insurance covering this or that? So there's many faces that fear and anxiety presents itself. Teacher of the Heart is about truly seeing that individual and loving them despite however they show up in your office. I brought an example of myself when I was a fourth year dental student, and the person that embodied that for me was a professor who knew me in the clinical setting for 2 years. He knew my work. And one day I wasn't feeling well. I was trying to push through it, and I mistook the angle on a tooth, and I over prepared, and therefore there was a pulp exposure. And obviously I was really upset with myself, but this doctor saw me beyond that one mistake. And it was really important when someone is there for you when you can't be there for yourself, and they really see you as who you really are. Another example is I had many friends who were my patients as well. And when they came to my office for dentistry, all of a sudden they became different people. And I kept wondering, well, this person is usually so friendly and kind and nice. And then all of a sudden they come for their dental appointment and they become this really angry and frustrated person. What's happening when they walk through my door? And that's all fear and anxiety. So if we as dentists don't see the individual as they truly are, then we allow that fear and anxiety to affect us, and then we become uncentered. We carry on their negative experience, and then that stays with us, and we carry it to the next patient and the next patient, and then we take that home at night.
Right. And you just mentioned also saying that love your patients regardless of how they show up. It is a hard concept, what exercises you think a dentist or new dentist, can do and develop to be empathetic for the patients, and in the line you said, love your patients regardless of how they show up.
Yes, the exercises that really help are grounding exercises. And if anyone wants me to send them something, just go to my website and request that through the contact section of my website. There's a meditation that really grounds the individual to the earth so that as dentists, we remain centered, so that we have proper boundaries set up for us. And that way, we're not affected by every negative feeling that comes into our office. So you can see through the eyes of love only when you're really centered in that place where you're not affected by everything around you.
Now, do I understand centered more like, of course I've read the book, so I know that meaning of centered in the book, but do you think I can replace the word centered with compartmentalize the feelings between what I feel for the patient and still trying to do what's right for the patient and not get bogged down by his or her feelings? Can I use the word we are more compartmentalized in that regard?
No, it's not so much compartmentalized. So compartmental means that you still feel it, but you put it in a compartment where you don't have to deal with it anymore. The concept that I'm describing has to do more with so love is a higher energy. And negative feelings are a much lower energy. If you're maintaining a higher energy, the lower energies can't even find you. So if you're in love energy category, the negative feelings of the patient just don't even affect you. So it's more about not letting it affect you rather than compartmentalizing it.
Okay. Right. So, I think now is the time to kind of unravel a little bit here. So there's a line, I think it's a pretty deep line, on page 17 of your book, which said, application of the methods proposed in this book does not erases the traumatic events, but instead erases the emotional signal attached to the memory by eliminating the disturbance of energy flow in the energetic field. So I think this, if you explain this line, elaborate on this line in a little detail, people would understand what your whole book is all about. I think this is a very key, important line because it discusses energy flow, of course, in the energetic field, the disturbance of it, and the whole idea of erasing the signal and not the event per se. So I think
that's a really good question. Yeah, that's a very good question. One of the case studies that I mentioned in the book actually is a perfect description of this. There was a patient who participated in the study, and she had a really bad dentist. It was actually a family member who was her dentist. So he really hurt her. He didn't listen when she said, "I'm not numb." He continued working on her, even though he knew she expressed it in fear. So what happened was after we did this method on her, she still remembered that this family member was her dentist, that he hurt her. She remembered all of that, but she no longer cared. So this method doesn't erase a memory at all. She still remembered that, oh yeah, this family member hurt me, but that signal where it upsets you is no longer present. It's not a change. It's just, okay. It's like usually we have proper energy flow in our body.
Okay.
When an individual has a negative experience, that negative experience interrupts the flow of energy. Mm-hmm. So if energy flow is disrupted through the energetic pathways, the system that would get the energy is now not getting the proper energy, and that eventually ends up causing disease. So that's one aspect of it. But there's no transformation of energy. It's just we're going from proper flow of energy that usually exists. Negative experience disrupts that proper energy flow. And so now that meridian is not transferring energy properly.
Right.
And therefore everything goes haywire. Okay.
So for the audience, could you just elaborate this part a little bit? So when there is a disruption of the energy flow, how does it impact the patient? What are the ways that it impacts the patient? And how fixing that flow of energy actually makes them more compliant to what you want them to do?
Yes. So let's say a patient has had a previous awful experience at a dental office, and it doesn't even have to be a dental office or a dental experience. They could have had a drowning experience that was negative, or they could have been at a physician's office where they had a bad experience, or maybe it was sexual abuse, where obviously that's a very bad experience. So
Right.
those negative experiences, the energy flow gets blocked. And this doesn't go away. It just stays. It's like our brain is like a library. It just stores negative information and it puts it in a library. Now, let's say this person makes a dental appointment.
Right.
All of a sudden, that stored memory of that negative experience pops back in. And oftentimes, patients aren't even aware of it. Maybe the day before the appointment, all of a sudden, they feel this kind of anxiety and they don't know what it's about. And anxiety is when an existing stimulus trigger does not exist. So patients sitting at home with their family, and all of a sudden they get, I don't know why I feel full and my heart's racing. And now they're at a point, they're having all the symptoms, maybe rapid breathing, heart rate increases, and they still have no idea.
Right.
There's many ways, that doctors can actually recognize those presenting factors in a patient. If you don't recognize it, you can actually do this method and find through muscle testing that I discuss in detail which pathways are blocked. Once you know which pathways are blocked, then you know which negative feelings were the origin of this pathway being blocked.
Right.
And by tapping on areas in the body, which are called acupressure points, you can get that flow of energy going again. So by the end of this method, the energetic pathway is now flowing. It's no longer blocked. Patient still remembers that, oh, yeah, I do remember I had a drowning experience and etc. That's why right now I can't take it when somebody puts water in my mouth or gets near my mouth. So the story makes sense to the patient. You've just recognized the original negative experience that caused all of this problem for the patient. Patient is witnessed now. There's somebody in front of them, hopefully the dentist, who has now heard their story and witnessed that. And they know what the source is. So they no longer have that emotional signal. They remember it, but they're no longer bothered about it.
And they're not bothered about it because the energy flow, at least temporarily or for relatively, not permanently at least, has been changed by your method of changing the energy flow. And that causes to continue for the patients to continue adapting and become more compliant.
It is at that point you can figure out all of the energy pathways that were blocked. It's not just one. So you know how a nervous system is all connected together. So
Right.
is the vasculature. It's all together. So the pathways are all connected together too, the meridian pathways. So if one pathway is blocked, it does affect the next one and the next one. So by doing this method, you can identify all the pathways that are affected. And then you give that homework to a patient and you say, okay, these were all the pathways that were blocked for you. It would be good for you to do this homework by tapping all these points 3 times a day for 3 months, whatever that ends up being. And the protocol is through muscle testing, you'll determine how many times the patient needs to do this as homework for it to be permanent.
Yeah. No, I think muscle testing is the key word here, is the key phrase here. Basically, the idea is you test a muscle in a certain way, which is in the book, by the way, somebody who was interested. And then the muscle test would tell you whether the person is telling the patient or patient involved is telling the truth, or he or not, right? So with the muscle test, you go either in this direction or that direction. If you feel, for example, that you need to do this homework for 3 months, 4 days a week, does a muscle test positive to it? For somebody who's interested, as I said, go and read about muscle testing, and you'll understand. And if they test positive and they're strong with it, that means this is what their body wants for them to fix the energy flow that's going on in the body right now.
Why we even rely on muscle testing.
Mm-hmm.
If an individual is asked about a question, the mind can hide a lot of things in the subconscious part of it.
Right.
And the patient might not even be aware of the correct answer. However, if the body is tested, the body doesn't lie or can't hide anything. It will tell you the truth.
Right.
So usually muscle testing is done on the deltoid muscle. You present a question to the patient and you test that muscle for a true statement, or is that a false statement? It's true or false. Okay.
Right.
That's how you know which meridian pathways are blocked. So now that you've figured out which pathways were blocked and which ones are going to be homework for the patient to do, no more muscle testing is required. However, if a patient comes back 6 months later and they're still exhibiting signs of fear and anxiety, perhaps they didn't do their homework or whatever the situation might be, you would need to go back, start with muscle testing again, and figure out, okay, which pathways are now blocked. So muscle testing is really good to do at the beginning to identify which pathways are blocked.
Why don't we try to bring all of this together, what we've just discussed, in a little, so that audience can actually understand what are we trying to achieve here with your method?
Of course. So, the reason we even do all this is to help our patients be able to sit in a chair and have the capacity to even understand the information we're giving them. And number two, it helps the dentist to go through an entire day and be able to help their patients without getting stressed, without unnecessarily getting stressed. A lot of times what happens is patients sitting in our chair and we give them all this information and they look at us, nod their head, they walk to the front office. When the front office asks them, oh, do you remember if Dr. Smith told you about what's needed to be done for the next appointment? They don't remember a thing. Well, it's not that they got amnesia from the treatment room to the front office. It's because they were so anxious and fearful that their brain didn't even register. They were in that frozen state where they didn't even remember or understand or comprehend anything that was told to them. So that's a lot of frustration for the dental office, because now the front and back are looking at each other going, well, didn't you guys explain all of this to the patient? And the back says, well, of course we did. We took 10 minutes explaining all of this. But the patient was not in a space to understand. The patient doesn't tell them or can't retain it, then all the treatment plan recommendations that you're giving them, they're not going to accept it. Because imagine if you're in a jungle and all of a sudden you're faced with a bear who's going to attack you. You're not going to remember anything that's being told to you, especially if a dentist is also present saying, oh, you need, class 2 composite. I mean, they're just not going to be able to understand or retain that. The only thing they care about is how fast can I exit here. So a lot of times the treatment plans that we give our patients, they don't accept them. So the treatment plan stays in a patient's file as something that patient never accepted. And then they come back again, and then we do the same thing again, and they don't accept it. So dentists often feel frustrated that their patients are not accepting their treatment plans. A year or two can go by, and then the patient now needs a root canal. And the dentist said, well, Mrs. Jones, I informed you that
Right.
you needed YZ done. And Mrs. Jones says, no, I don't remember you saying any of that. And that's where, there's a break in the relationship between the dentist and the patient. Dentist says, no, I did. I have, all this documentation, and the patient can't remember a thing. To our patients, if our patients can't relate to us, then there won't be any trust. When trust is broken, we have bigger problems. So this method really allows for that, original negative experience that makes our patients go, get their sympathetic nervous system all fired up. It takes care of that. So our patients can be present during the appointment, can hear us. They can listen to us. They can retain it. Our treatment plans are going to be accepted at the time that we present them. And so inevitably, the dentist profits will increase and the patients will be healthier. That's the whole point of this book.
That does help. That does help understand the advantages of doing your system. So let's go back to a little history here, so that people can relate a little more. What was your turning point to get into such an exercise? To learn such an exercise to calm your patients down with your method, your well-referred dentist method, I would call it as. What was your turning point to learn and to get into such research about calming the patients down with your method?
Yeah, of course. As I said in the book, I'm an empath. What that means is an empath feels other people's feelings as though it's happening to you. So it's not that you're having empathy for someone. You're actually feeling those feelings as though it's happening to you. So from the beginning of my career, I know that I was, and in a day, it was just draining. So not knowing what it was, not knowing what an empath was, I just, kept working through it until, I was profitable. I had a nice practice. And if you've been in practice long enough, at least for me, every 7 to 10 years, some event happens where your external conditions change. So all of a sudden you find that, okay, what I've been doing in the past is not really working anymore. For me, that came in 2007 when the financial crisis happened. And then we went into that Great Recession, and literally my family, groups of patients were leaving California, lost their dental insurance and everything. And there was palpable fear and anxiety, not only with my employees, but also just with every patient that came in. And that's when it really came to a head. I thought, okay, no, nothing's working. There is this real negative energy that's happening. And if I don't figure it out, then down too. And I kept searching for any university, any program, any course that would address this, and nothing did. I finally found a university in Northern California, and although I was still running my practice, I went for a 3-year certification, and that was my introduction to energy medicine, energy psychology. And every time I had to do research, I did it on fear and anxiety. When I started to do this and I learned how to ground myself, how to center myself so that I can love my patients in whatever form they presented that day, I learned how to alleviate patients' fears and anxieties through doing energy psychology methods. So I found
a school that actually taught energy medicine and energy psychology, and I enrolled in a 3-year certification. The result of that was knowing how to properly center myself, and that allowed me the opportunity to not be affected by all the negative feelings around me, and not to absorb everybody's feelings and get drained. And through the energy psychology methods that I brought up in the book, it between you and the patient, there's this trust. By the end of this method, there's a trust between you and the patient that I've never experienced before. My patients completely trusted me after that. They didn't care if their insurance didn't cover the entire fee, or they didn't care that that might be a cheaper office down the street. They trusted me as the person who had their best interest in mind. And even when I sold my practice in 2017, the dentist who bought my practice said, "Dr. Saleh, these patients love you. Like, this is beyond a doctor-patient relationship. Like, what did you do?" And that's it. That's all I did, is number one, to truly see them through the eyes of love, which you can only do if you're centered yourself. And number two was this method. And I want to add that any person, like any patient that I asked in my practice to do this, if they were interested in going through this method, there was not one person that said no.
Oh,
I mean,
okay.
they were eager. They were like, "Should we start now?" is what they said. And all the case studies that I discussed in the book were done in 90 minutes, except one person who had a parallel sexual abuse and dental fear. She took 3 hours, but literally everybody else was a 90-minute. Now, if you're new to this, you may break that down into 3 appointments, into 3 hourly appointments, but you don't have to. Once you're certified in this method and you're comfortable doing it, it literally will not take more than 90 minutes.
Oh.
I'm going to use an analogy.
Sure.
Because let's say every time a patient comes to your office, they don't see you. They just see an angry bear, let's say. And these are patients who are fearful. Okay. So they can't distinguish you from the trauma that they felt at some time in the past. And let's say that trauma was facing an angry bear.
Yeah.
So when an angry bear is sitting close to them and talking to them, they're cut out. They're in survival mode. They either want to get out of your office as fast as possible, which is the flight part of the sympathetic nervous system, or they want to fight. That's when they get angry and they start complaining about your fees being high, or that their cousin went to a dental office and the dentist didn't ask for any copayment. I mean, there are so many things that a patient who's fearful can bring up as resistance.
Okay.
What this method does is it removes that angry bear, so that when a patient looks at you, they see you and not the angry bear anymore.
Okay.
So they will remember that, oh yeah, at some point I was hurt by an angry bear. But Dr. Pink is not that angry bear.
Right.
So whenever I see Dr. Pink, I'm no longer triggered to feel that fear that I felt with the angry bear. Now I can, my faculties, I'm able to hear Dr. Pinks when he talks to me, and I can retain the information he gives me, and I'm going to, I trust him now. He's not somebody that I need to run away from.
Okay. Now, who did you think, as we were doing a little pre-call, and we agreed, and we both agreed that it is not for a high volume office. So who did you think is a target audience for your well-referred dentist method?
Any dentist in private practice.
Okay.
Because, it's important to realize that in private practice, the way that we sell our services, which is dentistry, what needs to happen before we were able to sell that successfully is that trust needs to exist. So patients are coming to us, they're willing to pay us to get good service. But before that happens, they need to trust us. So in private practice setting, there is availability of time for that communication to happen between the dentist and the patient, and the explanation and go through this method. So there's time for that. And you can certainly charge for it. It's not like you have to do this for free. You can definitely charge for it. But when you charge for it, you need to let the patient know that there's certain things that you need to do, and I don't want to get into it here because I want to be able to properly portray it. We might not have time here. But there is time in private practice to do that, whereas in an HMO practice or DSO, there is no time. They rely on volume to do dentistry, and it's just a different model of practice. So my audience are dentists in private practice, whether it's individual or group, doesn't matter, but it would be private practice.
Got it. Now, seems like you went in 2007 to do this. How long did you implement well-deferred dentist method in your own office?
Actually, I started in 2013.
Okay.
And, my actual certification, it took 3 years.
Yeah.
So in 2016, I did one study, which I described, the case studies are described here in 2013. Then the 4-minute method was done early 2016.
Right. We'll get to that. But, so basically, more or less you started in 2013. And did you do it on all the patients in your office? This method?
No, I did it on select patients that I knew were very fearful.
Okay. So only fearful and anxious patients starting from 2013. And,
there's a scale between 0 to 10, 0 being no fear of dental treatment, 10 being the worst fear. And basically, if you just ask a patient on a scale of 1 to 10 or 0 to 10, where are you as far as fear and anxiety about dental treatment, they will tell you.
Right. Do you remember any particular patient, any particular case where you had the most dramatic effect of well-referred dentist from 10 to, 0 or 1 that he or she is able to do or was able to do all the work that you recommended or mentioned?
Absolutely. There were many.
Okay.
One individual, particularly, this person had come to my practice one time for bleaching his teeth. And he was so nervous that he would not hold eye contact with me.
Wow.
He had visible sweat coming down his face, and he couldn't even talk to me. He came for his bleaching, and then he left, and I didn't see him for 3 years. And this went on for many years. He would come back for some little thing, like something hurt, and we would fix it. But this individual was very, very afraid, to the point that he would, clutch the chair rail and hold on and, white knuckle it. And just, there was a lot of visible anxiety and fear going on. When I did it on this individual, after this, he actually would fall asleep in my chair. And anything that I recommended, there was no question about it. Whereas before, it was, oh, well, I can't afford that. Oh, well, will my insurance cover it? After he went through this method, nothing, none of that, all of that went away. Okay, when do I schedule for it? When do you want me to come back? Those were the responses I was getting.
So basically, it wasn't not only in the chair cooperation, but also, the cooperation in, I'm ready. I'm ready when you are.
Oh, yeah.
Kind of, okay.
Yeah. Yes. It was, when would you like me to come back to do this?
Wow.
It was not like, oh yeah, I have to check my calendar and I'll get back to you when I have time. I have to talk to my significant other before I decide. None of that was there anymore.
Oh, interesting. That's very interesting.
Yeah, it's a different way. It's a different way of practicing dentistry when your patient says, I accept, and when would you like me to come back?
Yeah, I've been, I think some of my patients say that to me, even though I don't use your well-referred dentist method. Not all of them. I mean, I'm not as good as you in this method, but I think as you were telling me that I think I'm an empath too. One thing that hurts me is when I'm actually numbing my patient. I'm like, I'm so sorry, man. I'm sorry it hurts you, but I know it hurts you, and some of my patients have said that I do a good job in numbing them, whatever. It's not about me here, by the way, but what I was trying to say is only very few of my patients say, I'm ready when you are. But if you say you can make those patients, many of your patients, to say the way I'm ready when you are, that's a big game changer, I would say. That's a big game changer.
It is. Yeah. It is. And Dr. Pence, we talked about it. You are, by you being so aware of what the patient might experience and presenting that truth to them before they're hurt or before they experience pain, that also creates trust between you and the patient. And that's great. But with patients that would qualify for this study, they would have to be, from that scale of 0 to 10, they would have to be in the 7 to 10 range.
Right.
Where, nothing we do as dentists, as caring dentists, helps them. They still, they still can't properly sit in the chair and allow us to do the dentistry that we can do on them. Those are the patients that are much more difficult to get them to trust us with empathy and care and compassion.
Yeah. I mean, to be honest, I think you also have what we call a 4-minute protocol. You were touching on that topic a little bit. Why don't you tell them a little more about your 4-minute protocol? Because that's going to start them, it's going to start them slow, but then it's going to give them a little more confidence in your method too. So if you don't mind, please discuss a little bit about your 4-minute protocol.
Mm-hmm. Sure. Sometimes you just don't have time to discuss this with a patient who arrives for an emergency. Right. Let somebody call your office at 4:30 and you're about to close at 5, and they have an abscess and they need your help, but they're also very afraid of dental treatment. So you need something quick to get them to sit in the chair so that you can do an emergency treatment on them. And the 4-minute tapping protocol, when I did the study for that in 2016, dental fear and anxiety was reduced by 35%. And that's a lot. That's the difference between a patient not being able to sit in the chair versus a patient sitting in the chair for 20 minutes while you excise the abscess and, move on to help them further. So it's great for an emergency type situation. It only requires tapping on 7 acupressure points, which are on the body. And they need to do that just for 4 minutes. So you
wait a minute. Did you say tapping like with the tip of the finger kind of thing? Tapping?
Yes.
Oh,
tapping gently.
Very gently.
Tapping.
Okay.
Very gently.
Okay.
So there's no force. You don't want to bruise the skin or anything. It's very gentle tapping, and it's that tapping that gets the energy flow going.
Oh, okay. Okay.
The seven acupressure points that I found were useful, they go back to the 2013 study. I found that these acupressure points were most commonly the places that were blocked with patients that had dental fear and anxiety. So I said, let's get rid of all the extra stuff. Let's just tap. on
Wow.
these points,
Mm-hmm.
and let's see if that reduces anxiety. And that's when we found that, yes, it does. It reduces anxiety by 35%.
Wow.
So this is really useful to, for example, an HMO practice or DSO practice, or, even a private practice, when an emergency patient shows up and you've added them to your schedule and you don't have time, your auxiliary staff can just tell the patient, I'm going to do this with you. Just tap on these points for 4 minutes and let's see how you do.
Okay. So you're saying, what are those points? So if I tap on those 7 points, how would I even know that whatever I tapped on actually worked?
So that's a very good question. So, the patient that shows up in an emergency and they obviously have pain.
Yeah.
And you ask them to sit in a chair and they're very ambivalent. They're exhibiting signs of fear and anxiety. They start asking questions after question, and they have to use the bathroom every 15 minutes, for example. So the dentist is actually seeing the red flags of fear and anxiety right in front of their eyes.
Right.
And that's when you can take a patient out into a consult room or something, or the front area, and just say, we're just seeing a few areas, a few fears and anxieties that are going on. Let's just tap on some points. And, you take the patient through that protocol of 4-minute tapping. And then you ask them, from a scale of 0 to 10, how much anxiety or fear you're experiencing right now. And the patient will tell you.
Okay.
They will say, oh, you know what? Yeah, I was at a 7 before. I was at a 10 before. Now I'm at 4.
Oh, okay.
And then you can say, are you able to sit in the dental chair now? And they will. They will go and sit in the dental chair. And now you can, spend 15, 20 minutes doing what you need to do to get them out of that emergency situation.
Right. Now,
and that's what you know.
Now, this is, now I'm just thinking like another dentist who hasn't read your book yet and just listening to this podcast. And they're like, how do I even go and approach to a patient and tell them, hey, I want to tap those 7 places on your body and it's going to make you, it sounds stupid. Sorry. But, for an outsider who has not accepted this well-referred dentist method, for them, it would be like, what? Tapping those 7 how do I even approach that, to the patient, that I am eligible or I am trained and competent enough to even do a 4-minute protocol or something similar?
Absolutely. That's a very good question. So let's go through it.
Okay.
You have an emergency patient, shows up, it's a new patient.
Yeah.
Someone you've never met before. And, you do what you do normally. You go through their health history and ask them what's bothering them. And while you're doing the exam, you're seeing that you're identifying red flags of fear and anxiety. And you tell the patient, as you see them, you want to be able to verbalize that to the patient. Now, I'm seeing that you're moving your head away from me. Is there a reason for that? And they will tell you, yeah, I'm really afraid, or I don't like being touched in my face or my mouth.
Right.
I'm in pain, they will tell you. And once you get 2 or 3 of them and you let them know that, I'm seeing this, that, I'm seeing that you're, for example, bringing your chin up and I can't access the area that I need to access. These are typical signs of someone who has a lot of fear and anxiety. And you let them know that there are a lot of patients that feel that way. And we've been able to help them through energy psychology methods. Have you heard of tapping?
Okay.
The layman term is tapping. And a lot of people have heard of tapping.
Oh, okay.
Or if they haven't, you can say, have you heard of acupuncture? Without needles. This is kind of like acupuncture, but we don't use needles. All we ask you to do is tap. And if you're open to it, we can walk over to our consult room. You just need to sign an informed consent allowing us to help you with your fear right now so we can treat you.
Okay.
Are you open to that? And then you walk them to the consult room. They sign the informed consent. Someone sits in front of them and says, this is really simple. Just follow what I'm doing.
Okay.
And you tap, and then the patient taps on themselves as you show them. The only thing is you don't want to look directly in a patient's eye when you do this.
Oh.
And you want to ask the patient not to look directly in your eye, because what that does is you absorb their negative energy. So you want to be completely neutral and not look directly at them. But you just show them where to tap. You put the clock on for 4 minutes. And before you start the tapping, you say scale of 1 to 10. Where would you rate yourself as far as dental fear and anxiety? And they will know. They'll say, I'm a 12. And then after 4 minutes of tapping, after 4 minutes of tapping, then you say, great job, from a scale of 1 to 10. Where are you now?
Right.
And if they say, I'm a 4, but I can feel the pain from my tooth. But as far as being afraid of treatment, I'm around a 4, probably 3 or 4. And then you say, good. Would you like to go back and sit in the dental chair and have Dr. Smith work on you? And they'll say, I can do that.
Okay. So the response is very subjective, like patient oriented. Patient said before, and you tap, and then what does the patient say? There is no objective way of actually comparing it. Of course, the patient is ready. That is one of the good subjective ways that he or she is ready. But does it depend on
the 4-minute protocol the 4-minute protocol? We're relying on a subjective response from a patient. So with the 4-minute protocol, there's no muscle testing. There's nothing that we do with the customized method. So we do rely on the subjective answers. Yeah.
Got it. So 4-minute protocol is, I think you already answered my next question. So 4-minute protocol is more like a subjective response to your method. But there is no way of confirming it objectively. And that's the reason people should do a full 90-minute protocol and not only the 4-minute protocol. Am I right? Is that what you would say?
Absolutely. Yeah. I mean, the 4-minute protocol is just to be able to get the patient sit in the dental chair for maybe 15 minutes. So you can, do what you need to do emergency wise, but, to really understand, to do a customized, tapping for the patient and really, see which meridian pathways are blocked. Where are the treatment points that need to be tapped? That really is a customized 90-minute slot of time. Yeah.
Got it. Now, did you used to charge extra for the patients in your own office?
I did. I charged around, $150. It wasn't a lot, but you would whatever. It's not really the amount that you charge, but maybe do what you do for a new patient, like whatever you charge for a full mouth X-ray and exam. Charge that.
Now, okay. Now let me throw something at you right now. This happened.
Sure.
So, how would you even compare your well referred dentist method to a placebo effect? That means people want to get better. Of course, you are doing something for them, and the very thought that you will help him or her, just like in a placebo. Do you think it is somehow a placebo effect in that regard? I mean, you're telling them you're going to help them, and they feel good right away, especially in the 4-minute protocol. Do you think it's more or less like a placebo?
Well, what would really help, of course, is more research in this area. But the 4-minute protocol that I did for emergency patients, my control group were people that read a Golf magazine article. That was my control group. And I compared the people who tapped to the people who only read this boring Golf magazine article.
Okay.
And those people only improved by 6%, whereas the group that actually did the tapping, they improved by 35%. So that was a significant difference. And we actually had a statistician who did the comparative analysis, and they determined it was a significant difference. And all of this is in the article. My research is actually posted under my page on LinkedIn. So if you want to get into more detail, you can read that. But that's a very good question. How do you know if this is placebo effect versus not? And that study determined that it's not a placebo effect.
Okay. So statistically, it's proven basically your method is not a placebo, but actually it does have a significant correlation to whatever you were trying to study. Okay.
Yeah.
Well, that's interesting.
Yeah.
That is interesting.
But of course, I would love to do with more people, do a study with more people, at least 30 participants, and do a, blind controlled study group along with them. So that would be ideal. But I feel that this is a good starting point for all of us to kind of have an open mind and start doing it in our practices, and maybe the opportunity to do a larger number of participants will be available either by me or by somebody else in the future. That would be great.
Yeah, I mean, believe me, I think everybody needs more studies. Even the crowns that we do needs a more study. But that being said, now, little on the legal and the malpractice aspect of it. Okay, now one thing which kind of bothers me is, anytime one of my good friends, he's really, very legal oriented guy. So he always finds something. Is it legal? Am I going to get in trouble? Am I going to have a malpractice insurance trouble in this? Because I don't have a 3-year degree, which Dr. Saleh has, for me to even do a 4-minute protocol. Forget about a 90-minute and forget about, you understand what I'm saying? So I think what I'm also talking about is the legal ramifications, the malpractice insurance thing. How would that come into play?
Absolutely. And, as a practicing dentist back in 2013 and 2016, those were my questions as well. And I asked all these questions from my malpractice insurance. And so I'm going to tell you a little bit about the concept, and then I'll tell you what you need to do in order to not mix the boundaries. So, in dentistry, we're supposed to manage our patients so that, if somebody comes in and they're having anxiety, if they faint, we bring them oxygen, we're trained in energy medicine. Or maybe when they're getting nitrous oxide, they get too much, they're not titrated properly, and they end up throwing up all over the place. We're supposed to clean it up, calm them down, re-titrate, and basically take care of our patient.
Right.
So when you look at this method, all you're doing is you're preventing an actual anxiety attack, and you're helping your patient to get healthier. So the outcome is the same. However, you're right. Maybe somebody is not trained. Maybe somebody is not certified, and they have an emergency patient come in. So that's why it's good to get certified and learn the right way. I don't recommend a dentist who has not been certified to even do the 4-minute method.
Okay.
I think there's a lot of responsibility that we carry, even though the research has shown that nothing bad is going to happen to the client, even if you do it wrong. Like nothing will happen, nothing bad will happen. In the 4-minute protocol, even if you completely mess it up, nothing bad's going to happen. But even so, it's best to err on the side of, not doing it if you're not trained in it. Once you are trained, I go through a long list of things that you have to do. One of which is you have to have an informed consent,
Okay.
so that every patient in your practice understands, has read this informed consent, and understands that while you're doing the tapping, you're not acting as their dentist. Very important for the patient to understand that, because you don't want to mix your dental license with energy psychology. It's just, they're two separate things. And you want to make sure that the patient understands that too and signs it. And you never want to do the tapping in a dental operatory where you practice dentistry.
Oh, that's why you said to take them into a consultation room.
Yes.
Oh, wow.
Yeah. You want to make that distinction that in the dental operatory, I'm your dentist right now,
Okay.
but your dental appointment is going to be put on pause because we're going to walk out of the dental operatory. We're going to go to the consultation room where I can do this energy psychology method with you. And while I'm doing that, I'm not acting as your dentist.
Okay.
Because, there's kind of a very distinct separation between having your dentist hat on and having your energy psychology hat on.
Okay.
And the patient understands it. And as long as that is, it doesn't have to be a consult room. It could be another room where you don't do dental treatment. Everybody's office is different. But it has to be somewhere where you don't perform dentistry.
Right. Okay. Do you?
As long as those two are met, then you're fine. But even so, I would ask an attorney to go through your informed consent. I have sample consents that I can give you, but you would always, of course, be diligent and have an attorney look at it to make sure everything is correct and it's a proper informed consent for the patient.
Sure. Now, on a very similar note, so for example, now the other important key members in the office is assistants and or hygienists. How do you relate such a new concept of energy psychology to them? Hey, I'm only trying to tap their acupressure points, how do I bring them on board, basically? For example, somebody does come and learn the energy psychology method, and how does he come back to the office on the next Monday, for example, and then he say, hey, you know what, we're going to start doing this. How do I bring my other staff members on board for that?
Of course, that's great. Remember that whoever facilitates the session needs to be trained and certified. So this is not something that the doctor knows how to do and is certified in, and then gives instruction to their hygienist or assistant to do it on the patient. Whoever is certified and trained, that's what I would recommend, would be able to do it with a patient. I would not recommend the dentist saying, well, I've learned it and I'm going to show it to you.
No. I think I'm asking something else. So let's say I come and learn from you, right? And you've taught me, and I come back home, to work, the following week, Monday, and say, and I talk to my staff members, listen, I am certified, right? I'm going to do all the energy psychology methods. Now, how do I convince my staff members and my hygienists, etc., to convince them that I'm not doing some voodoo stuff? I'm actually doing something credible, something really important, so that the whole environment in the office is congenial for the patient in a way.
Absolutely. I understand that now. Yes, that would be great, because, you want your staff to also be able to answer questions if patients ask it, or talk to patients and say, yes, Dr. Panks is now doing this and it's great, and, go over the benefits of the patient. So that's a great question. I was also concerned about this, and it's amazing. Our team, in general, assistants, hygienists, they already know so much. They've heard it. They get so excited excited when their dentist starts to talk to them about this. It's amazing how much they know.
Oh.
And the way to explain it to them, even if they don't know anything, is to tell them the benefits. You know, when you talk to your hygienist, you say, "Hey, Sally, I know how frustrating it is when patients come in and they're fearful and you basically don't know how to help them. So there is this certification that Dr. Saleh, for example, is offering, and I'm going to be doing that. It will help our patients with their anxiety and fear. And I want you to be able to talk about it, talk to your patients about it, because once I'm certified, I'm going to be offering this service.
Okay.
And you will be amazed. I mean, they're going to be so excited and all over it. I've never brought something new into my practice where has resulted in so much joy from my staff
Well,
that this method did.
Let's put it this way: you're one of the 5% in the whole in the whole country, I should say, the top 5%, because everywhere I see one common thing, that the staff, they don't like change. They don't like change. They don't like, even if I move their stapler from left to right, and they're like, "Where the F is my stapler?" And right, it is very true. So bringing a whole new concept to new office, I think there would be some kind of, I don't want to use the word resistance, but a little bit of hand-holding and teaching and making sure that they are, really comfortable about the energy psychology method. Otherwise, if they're not open-minded, some offices have older staff members who've been doing this thing for 30 years. They don't want to change anything. So I think it is really important for them to bring on board before we start. That's my personal advice, but everybody knows their staff members better than me. So I think.
Well, actually, let me, Dr. Pace, I would like to answer that. Fear of change is one of those fears that's very common. It's our staff, our patients. Nobody likes change, and you're absolutely right. The best way to help them understand the benefits of this is to, do it on them. I'm sure there's something in every individual that they have fear and anxiety around. It doesn't have to be dental fear and anxiety per se. Maybe they're afraid of swimming. Something. But as dentists, we obviously want to do it because, dental fear and anxiety is in our realm of work. But just do it on one person or every staff member and let them experience it themselves. That would be the best way.
All right.
Of course, after they sign the informed consent and all that.
Yeah, that's a given, right? So, where can one learn such a technique of well-referred dentist? Do you teach them?
I do. Yeah, I do teach it. I teach it on Zoom. It can be done online on Zoom. I have an 8-week program that I teach dentists. If they're local, I will go to their office. I'm there helping them understand it while they practice on people. So I'm very kind of involved in their teaching, and then they get certified at the end if they pass the exam. And then they can go do it. I mean, on the first day when I go through muscle testing, there will be homework to go ahead and muscle test on, at least 10 patients to get the feel for it. So it's very hands-on.
Okay. Now, are you the only one in the country doing it, something like that, or there are other dentists or teachers available? You're all the way up in California. That's why I ask.
Yeah, I am. Sure. And that's why I offer it online. So anybody can, anybody in the United States or outside can access me. But I'm not aware of anybody else that does dental fear and anxiety. I'm sure there's, people who teach energy psychology methods, but not for dental. At least if they are, I don't know. I don't know who it is.
Okay.
And people can just go on my website, which is www.drbitasaleh.com. Go to the contact section and send me just something saying that I'm interested. It's called the Fearless Way Method. I'm interested in doing the Fearless Way Method. That comes directly to me. And I usually set up a call for your audience. I do a 60-minute complimentary 60-minute call just to make sure that, they're fully committed. And then, then we start on Zoom.
And now Zoom, everything is Zoom these days, even dentistry is, I wish we could do dentistry on Zoom.
I know, isn't it? All the teledentistry is now apparently done on Zoom. I'm not sure, actually. I better retrieve that. Yeah, well, but Zoom is a great conferencing platform.
Right. Teledentistry, I did a very good interview with, I think your neighbor in LA, Dr. Arsh Hakamian, podcastofdentistry.com/session11. I think it was a really good interview. He talks not only about himself, but also about, not teledentistry. It was a fun interview. Initially, I thought it was going to be a very boring interview, to be honest, but I think it came out nice.
Yeah.
I was happy with it.
I definitely have to listen to that. Yeah. That's very important, especially now.
Yeah. All right. Now, this one question, which I didn't ask you, was primarily for me, but I wanted to understand the two terminologies that you used in the book, intuition and self-esteem.
That's a great question. So intuition is that gut feeling that we often feel, and everyone has intuition. It's not like some lucky people do and some don't. It's a natural ability to get that gut feeling. Not everyone actually listens to that intuition. The only way, actually, intuition isn't loud. Like, there's nobody knocking and saying, danger, danger, don't do that. It's not like that. It's very subtle. It's like a very subtle whisper. Like, I'm sure you've experienced this before. Maybe you're in a situation and you say to yourself, I just don't have a good feeling about this.
Yeah.
I can't put my finger on it. I just don't feel great about this.
Right.
And that's your intuition speaking. So, for example, when you're giving anesthetic to a patient and the patient gets numb, and then you start working on the tooth, your high-speed drill's going, and all of a sudden you might get this feeling that the patient is losing their numbness. And so a person who trusts their intuition will stop and they'll say, hey, Mrs. Jones, are you okay? Are you starting to feel this? And that patient will say, oh gosh, yeah, I was going to say something, but I was going to wait to see if it gets worse. So the dentist listened to their intuition and verbalized that to the patient. The patient now feels great because they're like, wow, you care so much. And they feel safe with you. But not everybody listens to their intuition. They'll doubt it and they'll keep going until then, by the time the patient actually feels it, they're jumping out of their chair. What we've found is that, self-esteem is very important so that you trust yourself enough where you can trust your intuition. So the minute that weird feeling comes, you're like, oh, you know what? She's losing her numbness. I got to stop now.
Wow. So
that's how self-esteem around your intuition, that's how they're connected.
So self-esteem is keeping faith in the intuition, the subtle message that you hear and acting upon it.
Yes, absolutely. And intuition can be, it's not only heard, it could be just a feeling, it could be, auditory, meaning that you hear something, it could be just a knowing that you have no idea how you know, but you know.
Yeah.
So it has different forms. Sometimes it's felt, so it appears in different ways.
Right. Well, the reason these two words were so important for me, this is all about me, not for my audience. They're welcome to listen. Jokes apart, the reason it was important for me was because almost a year ago, I felt that I had an intuition of something, in general life, and or dentistry. I don't remember the exact event, but then I did not listen to it, even though I heard the whisper, but I didn't respect the whisper as right. And then I kept that as a signal for me, and then next time somebody whispers to me, right, I'm going to listen to it and see how it goes, just to verify if my intuition is correct or not. And I listened to that next time, and I think it was correct, if I remember correctly. So, I continued listening to a little more, and and I think this topic also started because I was discussing with another friend of mine, and she says she's very intuitive. I'm like, what the hell is intuition? I mean, exactly. So it's like, I'm a very logical left brain guy, but lately in the past 1 to 3 years, I've, using my right side too, I should say a little bit. So, you were saying something to add on to, intuition.
Yeah, and that's great that first of all, you became aware of those subtle messages you were getting, and you did your own experiment. Next time it happens, I'm going to, listen to it. But also a great way to find out if your intuition is correct or not is to do muscle testing. So muscle testing, as we covered before, it's the body's response to a true or false question. And as you do muscle testing on a patient, or you can even do it on yourself, you will intuitively know what the answer is. And then when you muscle test, the muscle test confirms what you knew intuitively. Does that make sense? So when you start doing muscle testing, it's like training wheels for your intuition to actually trust your intuition.
Well, you answered my next question. I think you have a lot of intuition. My next question was actually was on a similar note, that how could I actually do the muscle test on myself and learn to, use muscle test as a training wheel? I was about to say something similar, and you already said it. So muscle test, I can do it on myself too. Is that what you're saying?
Yes, absolutely. You won't be using the deltoid muscle.
Okay.
But you can use your fingers, and since we're not on video, I can't show you. But for example, I'll try to describe it. You can put the tips of your middle finger and your thumb together, so it forms a circle.
Yeah.
And with the other hand, so you maintain this circle, let's say with your right hand. With your other hand, you take your middle finger and index finger.
Yeah.
And you put it inside that circle, and you go to break that circle. So you push your left hand index fingers into where the contact is between your middle finger and thumb, and you try to break the circle.
Okay.
So, let's say you ask, my name is Bita, and you can see if that's a correct statement for you or not.
Okay.
Since it's not for you, when you go to break the circle will break. Because it's a false statement for Dr. Pink, right? But when I do it, and I try to break that circle, I won't be able to break that circle because it's a true statement for me. So my muscle, my whole body will hold that as truth, and it'll be strong. Whereas if it's a false statement for you, your muscles will not be strong. The circle will break.
Oh, wow.
So that's just a testing method. Many other people use a pendulum. And they have to kind of train themselves, like how would the pendulum move for a true statement or a false statement. That's another way, but that could be, I don't like using that. I do like using your own hands to see if you can break the circle or not.
Wow.
Yeah.
I think this one question was enough, was good enough for me to the whole episode, a whole session. Yeah. Any other ways of improving intuition? Any other ways you think somebody can listen to the whisper?
A great way is journaling. When you do feel something, instead of dismissing it, write about it and date it. So check back maybe a week later and look at the circumstances that happened, or a month later and look at the circumstances that happened and see if that intuition was correct or not. Journaling is a great way to do it as well. A lot of times dreams, we often get dreams where symbols are shown to us. And the intuition, the feeling that we get after a dream tells us whether this was an important symbol. Sometimes maybe foretelling of a future incident that is going to happen or not. And those are called precognitive dreams. So a lot of times we can use our intuition to help us figure out what the meaning of the dream was. I touch upon that in my second book that is going to be published next year. But yes, there are many ways, but practice. That's the best way to really strengthen your intuition. And the more you have evidence coming up that, yes, my intuition was right, when I felt this and that, look what came true. It was absolutely right. You'll trust it more. You'll believe in it more, so that next time it happens, you will stop and pay attention to it.
That's interesting.
And the important thing is that everyone has it. It's a natural ability that, we have as human beings. It's not only a few people that have it. It's just that the important thing is whether we trust it enough to pay attention to it and act upon it or not.
Now, I usually don't dream. Is that a good thing or a bad thing?
Dr. Panks, everybody dreams.
I don't. I mean, I'm not saying absolutely not at all. I'm saying, once in 2 months I would dream something, because I'm usually, the way it works for me is I only sleep when I'm dead tired. So as soon as I fall on the bed, I just sleep. So, until then I would be awake doing something, reading online or whatever. But, I know it's a fun thing which I'm speaking about, but I don't usually, if I do dream, I don't remember any of it.
Yeah, that's the key, because, dream science shows that we all dream, but not everyone remembers their dreams. That's what science shows. Yeah. Okay. And that's very interesting, because that's one thing that I discuss in my second book, as an indication of how sometimes when we have a limiting belief about something, and do you know what I mean by limiting belief?
Yeah, I do. So, please, but my audience doesn't. Why don't you tell?
Okay. So a limiting belief forms when, and I'll use an example because it'll be easier. Let's say when you were a child, you were you were baking cookies with your mom. The phone rings, she gets out of the kitchen, and you go to continue, and you put the cookies in the oven, and you hurt yourself, you burn yourself. And it's a really bad burn. So as a child, you will form this belief that oven can hurt you. And that's a valid belief for a child going through that.
Yeah.
But if that belief is stored in your memory as you grow up and you become an adult, and the chances of you getting burned on an oven is pretty remote, but you still have that belief in your memory, And it's so bad that it prevents you from going forward in life to the point that you avoid kitchens altogether. Then that becomes a limiting belief. So sometimes when we have limiting beliefs and life gives us experience after experience to the point that that limiting belief now needs to not become a limiting belief, often we can have dreams that reinforces that. Okay, that was a belief in childhood. Now a new belief can replace that belief, something that's not so limiting. So that's a part of dream science where our dreams can help us. Interpretation of dreams can help us understand and replace an old belief with a new belief.
Yeah. No, that's interesting. No, that is interesting. I mean, I have read about it, but I think I was listening to Dax Shepard. It's a podcast named as Armchair Expert with Dax Shepard, and there's one podcast which was released on March 19th named Tom Silver. He actually tries to change those limiting beliefs. He's a hypnotherapist himself. So somebody who's interested into listening to something like that, I think we should listen to Tom Silver on Armchair Expert with Dax Shepard. It was an interesting podcast. So I would recommend you to go through if you wanted to. But thank you.
Absolutely.
I was reading that you are a certified coach by ICF. What do you coach people as? What do you teach them by being a coach? I mean, are you teaching them how to use well-referred dentist method, or is there anything else involved in the whole coaching?
Absolutely. So I would love to answer that question. A lot of people nowadays are calling themselves a coach without proper training. For example, when I came up with the well-referred dentist method, I could just get in front of my audience and just teach that. Just say, hey, do this, X, Y, Z, and go forward. And, I could give step-by-step instructions. That's really the job of a consultant. When a consultant gets in front of a dentist and says, okay, to meet your production numbers, this is a list of things that you can do. So go do it. Okay. A coach, however, will come in and look at your numbers with you. They will go through your values, what you find fulfilling in life, what your boundaries are. The coach will really get into who you are as a person. And based on that, they will help you write your policies. So a coach will not come in and say, do X, Y, Z like a consultant does. A coach walks with you every step of the path and helps you do a customized policy, for example, based on you, the individual you.
Okay.
So when I decided to help dentists with their practices, I have a lot of knowledge. I've been, practicing for 30 years. I know the operation of a practice backwards and forwards and left and right and every angle. But what worked for me may not work for another individual because our values are different. So for me to be able to help every dentist who approaches me, I would have to be a coach who can unravel this dentist life, what they need as individuals, what they value, what they find fulfilling, and that's how I can help them every step of the way into coming up with a practice that they can be successful in.
Okay.
So a coach is very different to a consultant, and learning how to be a coach really does require training.
Okay.
Someone really can't call themselves a coach just because they have experience in dentistry. That's a misnomer. You can't really self-proclaim that you are a coach. To be a coach and know how to walk that path with your client really requires training. And there are many training schools But the ones that are accredited by ICF, which is International Coach Federation, those that are accredited are the programs that are really good, and they obviously there's a reason they're accredited because they follow proper coaching methods, and it's a world of difference. It's a world of difference. So I figured, okay, I can't really self-proclaim myself as a coach unless I get properly trained.
Okay.
And that's why I went through a 1-year program with an accredited coaching program to learn how to be that kind of a coach.
So do you work at ICF? Do you work with one particular mentor or coach? What's the process basically at ICF?
Okay. Yeah. You have to, you basically go through a 1-year training by an accredited program, meaning that one that ICF says, yes, this program is accredited.
So it's like a school, just like a university or a school.
Yeah.
Okay.
Yeah.
Okay.
Just like, and it's, it's in person, some of it's online, but it's a mixed bag of whether it's online or in person. And you actually work on clients. So you have to have a certain number of hours that you've worked on clients. I think it's 100 hours or more. I think I had 150 hours of actually working on clients.
Okay.
And once you finish that program, and there's a lengthy exam, certification exam, it's not only written and it's not multiple choice. It's actually writing and also oral. Once you pass that, then you can become a member of ICF.
Okay.
And then based on the hours, then ICF has its own credentialing beyond that. But that's the first step, is to go through an accredited program and become a certified professional coach.
Got it. Yeah. No, thank you. I think this much of well-referred dentist information it's really dense in a way because they have to accept and open up what you've been trying to say and teach here. I think we can go to the next phase here, and I call this phase as Tim Ferriss inspired questions.
I was thinking, you asked me a question about what's the best way for dentists to introduce this to their patients.
Right. Yeah.
I want to add to that. I want to go back and add to that because this is a perfect time for dentists to do that. So if you want to ask me that, I'd be happy to go into more detail. So going back to when you said what's the easiest way for dentists to present this method to patients, right now during the COVID-19 stay at home, every patient is going through a lot of fear and anxiety. And I realize that dentists need to get trained and certified, and that would be a 2-month period. It's a great time to either write a letter to your patients or announce it on your Facebook page that, we're aware that a lot of people are in fear and anxiety about the future, about the unknown. So we are actually in training to be trained on a method that we can help our patients with this fear and anxiety. And we're all working really hard to learn this. Please ask us about this when you come back. Or when the stay at home is finished, it's a great opportunity to follow up and say, regarding our training, we've done our training. We're so excited about this. It's helped so many of our patients, our staff. And we'd love to tell you more about it. And that's when you can introduce the method to them.
And I think that'll be a good idea. All right. So now, moving to the next phase, I love this phase of interview. The last interview I did with Dr. Arsh Hakamian, and I had to, in the introduction, I said, even if you're not interested in teledentistry, don't listen to him. Just go and listen to the Tim Ferriss inspired questions, and you'll be happy that you listened. And believe me, I love this section of my interview. So the you seem to me a very grounded person. Okay, not centered, but really grounded person. I'm sure you're centered too, but grounded person. So do you have any morning ritual and any best practices that you do every day for you to be grounded, for you to be successful?
This is such a juicy question.
We have all the time.
I'm going to go back to, okay, so in 2007, I moved my practice 12 miles away. I had just spent a large amount of money building a new office that was just, it was beautiful, but it was also very expensive. So my overhead was now through the roof.
Yeah.
And when I moved is when, it was February of 2008 is when we opened our doors. And that's, of course, when the financial crisis happened and the Great Recession happened. And nobody was happy about the change, the fear of change that you were talking about before.
Yeah.
Nobody was happy about this change. No one cared that we were in this beautiful office now. And, the chaos that was happening at that point, and I described this in my second book in a lot more detail, was honestly, it was overwhelming. And the prior year, I had pretty much two full-time jobs. One was planning for this build out, getting bank loan and, getting an architect and an engineer and all the things that go with the build out. And I was also practicing full time.
Yeah.
So I was kind of burning the candle at both ends. And then after a year of having two full-time jobs, now I was in a position where, my overhead was 10 times more and no one was happy about the change. And I noticed that I started getting headaches. And, before that I had headaches, but they weren't bad enough to, where I had to miss a lot of work. But these were actually migraines. And there was one period where I had a migraine for 3 months.
Wow.
Every day. And it was like I had my fingers on 911 the whole time, like thinking that my brain was about to explode and I would have to call 911. And, I did all the tests that you do when you have a migraine to make sure there's no problem with things that are physiological, et cetera. And everything came back negative. So we knew it wasn't that. And so basically it became clear that it was stress.
Yeah.
And so as a last resort, I even tried acupuncture, nothing worked. And finally I said, okay, I'll try meditation. And I remember all my life, being a type A personality that most dentists are, I was no different. It was always about go, go, go and do, and, don't ever stop for a break. And all of a sudden, my body was telling me, okay, enough is enough. You need to stop.
Right.
And I enrolled in transcendental meditation and mindfulness. I had tried mindfulness meditation years ago and it didn't work. So I tried transcendental and Dr. Pang said it was amazing. My migraine within 4 days of learning transcendental, my migraines were less frequent, less severe, and within a few years they were completely gone. To the point that my neurologist couldn't believe it. It was amazing. But meditation pretty much I think saved my life, and I continue doing that twice a day. So with TM, and by the way, I have I'm not advertising for TM in any way.
Yeah.
But it's just something that worked for me. So I have continued that every day, twice a day, 20 minutes in the morning before I start my day, and 20 minutes around 5 or 6 o'clock at the end of my day. And the days that I don't do it because I get lazy or I allow other things to take priority, I really feel it those days where I'm not grounded and centered. So I cannot stress the importance of meditation for dentists and, business owners who wear many hats. for me, it's made a big difference. I do that. And also, there's a grounding meditation, which I'm going to talk about, but it does require some training. So I don't want to, summarize it and belittle how important the training is. But you actually ground your physical body to the earth, where you create a pathway where negative feelings that affect your physical body can be transferred through that pathway to the earth. And once you go through, at first when you do it, it's like a 30-minute meditation. But once you achieve that grounded state, you can also train yourself to be in that place of groundedness within 1 second. But you have to train yourself to get there. And then once you're there, you can say, for example, I am in that grounded state, and your memory will take you right into that state. So I do that often. Like, for example, when I'm on the road and somebody cuts me off, I sometimes have to say that to myself a few times.
I know.
And those are kind of the two my go-tos on a daily basis.
TM is, where did you learn your TM meditation? Where do you go?
I did a Google search, and apparently every county or city has a TM instructor. So by going to the TM site, you can put your zip code in there, and they tell you who the
tm.org.
instructor.
Okay. Yeah. tm.org. I know about that. Yeah.
Yeah, and also learning TM is very expensive. If you're a doctor or physician, or even I could write you a letter saying that TM would help this person on a medical basis or a dental basis to reduce their stress, you immediately get, I think it's a 50% reduction in price.
Yeah, and everybody can use it later.
Yeah, it makes it more affordable.
Yeah.
But it's a 4-day training where you go and get trained by an instructor who's an instructor in TM, and then you're done. It's a lifetime of training sessions. If you need more training later, you can just contact the instructor and go on for more. So all the extra trainings are all free for a lifetime.
Wow, that's great. So TM, okay. Now, how did you even end up getting into TM? Did somebody recommend it to you?
Well, at the point where the migraines were going on, all the medical tests were negative, and I'm like, yeah, it's stress that's causing the migraine. And my father, actually, he's a neurosurgeon, so it was interesting because as a neurosurgeon, he didn't have any answers for me, his daughter. So he has never believed in meditation, never, ever. And just as a last resort, because, my family was literally watching me with this migraine, and I'm sure it wasn't easy on them. So he was the one that finally said, I don't know, try meditation.
All right. Thank you, Dad. Thank you, Dad.
Thank you.
Yeah.
And that was actually what helped. So
yeah.
That's what got me into it.
What other changes? You've been doing it since 2007, if I may understand. It's been more than 2008. It's still more than 10 years or so. What have you experienced of, in Dr. Bita Saleh 10 years ago, who wasn't doing meditation, and now, and of course, the migraines are gone, that we know, but what else has changed in either your personality, your life, or in general?
Yeah, that's a really good question. So much has changed. One thing that's really recognizable is I'm less reactive. So when I'm with a negative person who, constantly triggers you. I'm able to hold myself and my energy and not get affected by them.
Okay.
So instead of reactive, I'm able to stay grounded.
Mm-hmm.
So that's one thing that I notice a lot. And also by the end of the day, I'm not so drained. You know, I feel like, okay, I have another 4 or 5 hours in me to, you know, do whatever. Just the overwhelm of negativity is a lot less.
Do you think you've got more physical energy, or do you think you can handle more pressure, even though your physical energy is similar or same?
Mm-hmm. Yes, I think it's more being able to handle pressure, probably.
Right.
Yeah, because if you don't, you know, going back to energy psychology, if there's negative energy around you and you absorb it, you're going to end up with disruption of energy flow in the meridian pathways. And just that can have a physical impact on you. So you get drained, you get tired, you're worn out. Whereas if you don't allow that negative energy to affect you, you're not going to let your energetic pathways to become blocked or distorted. So you're able to function as a healthy person versus somebody who doesn't have proper energy flow and, you know, gets sick or gets migraines or whatever, however it manifests in the physical body.
Do you think with energy psychology, you could say that you become all those negative energies going in wrong direction or in opposite direction, right? They are being corrected by your meditation? Could I say that?
Being corrected by meditation. Oh, I'm not sure if meditation is correcting them. Meditation is, I think it's allowing me to be in my grounded state and not take on negative feelings coming from others. And I'm not perfect at it, by the way. I still do get affected when I have a lot of negative energy around me. I do get affected, but there is also that awareness that you realize immediately what's happening. And you know, you don't go through a whole day and not realize what's happening. You immediately catch it and you say, oh, you know what? This is what's happening. I'm absorbing other people's negative feelings. These are not my feelings. These are other people's feelings that I'm absorbing. So I can quickly do a tapping. And on all my acupressure points, quick tapping. And immediately I feel more balanced. It's like that distortion of energy flow, that blockage of energy flow, I immediately release it. So it doesn't even have time to affect my physiology.
Ah, okay.
Yeah.
I'm glad. Yeah, I think that's a good understanding energy psychology in terms of meditation. I think that's what I was trying to do. Now, the most gifted book, if you have given.
Hi, Dr. Pink.
Hi, Dr. Saleh. How are you?
I'm good. How are you?
Good. All right. Can you hear me clearly?
I can hear you perfect. Before we are going on, I want to bring up one more thing. Is that okay?
Yeah, go ahead. Please.
There was a part in that little clip that you sent me at the beginning where it asked me, you know, what I do at the start of the day, and I brought up PM. There was also another thing I said I do, which is a grounding meditation. And the way I heard it on that clip, those two were blended together, whereas PM and this grounding meditation are completely two different things. The grounding meditation is just something I created to get grounded properly, and TM is TM. But the way it's sounding, it sounds like they're one thing.
My understanding was that they are two different things. I did not at least, presumed that they were done together. I presumed, at least with my understanding, that there were two separate things, and this is what you do. You do TM and then you do grounding meditation.
Okay, good. Maybe it was just the clip I got.
Yeah, I mean, I think I understood clearly. I wasn't confused about it. Yeah.
Okay, that's fine then.
Yeah.
Perfect.
Yeah.
All right. So I know we were talking about discussing about this particular question. Only one question we have right here, and So, do you think a meditation? Okay, I think I'll go back a little bit. I don't want you to read through whatever you've already sent me. Obviously, you can take help of what you've already written so that it doesn't seem like you're reading. Rather, whatever you want to say, just say it, casually. Yeah. So, all right. So, do you think meditation can actually correct flow problems or energy flow problems based on your energy psychology?
What kind of meditation are you talking about?
Whatever you follow up, like I think you do TM, so maybe we should stick to TM per se.
Okay, no problem. In order to answer this question, it's better to just discuss a little bit about the result that we get from TM and how TM works versus energy psychology. Mm-hmm. So with transcendental meditation, when it's done correctly and over time, the individual transcends thought altogether, which means there's absence of thought. Now, going back to energy psychology, if there's a negative thought that is created due to trauma, for example, which is what we're dealing with in dentistry in our patients that are fearful. When there's trauma, there's negative feelings created. And it's the negative feelings that disrupt energy flow through the meridians. If that disruption isn't cleared in a timely manner and energy disruptions continue, then it can cause disease or pathology or whatnot. So when we speak of meditation, as far as perhaps meditation prevents energy to be disrupted. However, I don't know of any studies that uses energy psychology, uses muscle testing, which is very centered around energy psychology. I don't know of any studies that uses muscle testing to test whether meditation corrects energy flow disruptions. I don't know of any studies.
Okay.
But the beauty of energy psychology is that it doesn't deal with thought. It just goes right to energy disruption. It finds out through muscle testing and energy psychology methods which meridians are blocked, and it goes to clear those. So it bypasses thought, because thoughts can be very tricky. The mind can be very tricky. Usually negative thoughts from trauma are stored in the subconscious mind. So they're not even in the present moment. They only come into present awareness when our patients are triggered by, let's say, a smell or seeing a white coat or the dental chair. Usually, though, when they meditate at home, they're not going to be triggered. They're not going to have all those traumatic memories in their present moment. So because of that, I think I would say no, that meditation doesn't correct energy flow problems that are existing.
Okay. And do you think with your method of well-referred dentist method, do you think those energy flow problems can be permanently cured? I think you answered it once, but I'm just emphasizing again. do you think they can be permanently cured by going through the reversal process of well-referred dentist that's in your book?
It's not so much reversal, but at least the study that I did with my patients, my participants in the study, was that they remember the memory. They remember that, for example, their previous dentist traumatized them. Mm-hmm. But the emotional charge about that is no longer present. And I saw these patients over a 3-year period after doing the energy psychology method on them. And initially these were patients that when you ask them from a scale of 0 to 10, 10 is the worst fear and anxiety you have about dentistry, they would say, I'm 7, 8, 9, 10, 11, or 12. So these were very fearful patients.
Yeah.
And as I saw them through the years after that, they were completely a different person. And when I would ask them, did you do your homework? Most of them said no, which means that they didn't repeat it. They didn't repeat the meridian tapping that I found for them.
Yeah.
So because of that, maybe we can say, yes, it's very probable that one session, that 90-minute session of energy psychology did help them permanently remove the charge on that traumatic memory.
Now, those patients were in your own office, right?
Yeah.
Okay. Now, when you left your practice in 2017,
mm-hmm.
with your experience or whatever you know, do you think those patients still came back even when Dr. Saleh was gone from the office?
I don't know. I'm not in daily contact.
The reason I ask is it because the trust that they developed in Dr. Saleh versus that well-referred method of energy psychology that you worked upon them for 90 minutes actually changed them to accept dentistry? Am I making sense here?
Yeah, absolutely. There's two questions in there, I think. One you're asking is, okay, you did the energy psychology method on this patient, for example. Mm-hmm. You developed this amazing trust with them. Is, of course, the trust that I develop as a result of doing these methods. That's between me and the patient.
Right.
If they go to somebody else, another dentist, mm-hmm. would that trust be present with that other dentist? And the answer to that question is, I don't know. But what I do know is that if we just look at the trauma that they endured and the negative feelings that came out of that trauma, those charges of emotional charges are gone. So if they couldn't sit in a chair for, let's say, more than 15 minutes, and they couldn't open their mouth because they were so afraid, if they're going to go to another dentist, it doesn't matter. They'll be able to sit in the chair long enough to get treatment done, and they'll open their mouth properly. So that has nothing to do with the dentist. That has to do with clearing the negative thoughts, the emotional trauma around that.
No, I understand that, but I certainly understand that. But so with your method, are you saying if you've done it and the patients have actually the trauma, the triggers are actually, since they are gone, the patients are actually more compliant, not only with you, but also with other dentists? Interesting. Oh, interesting. So, in a way, are you also implying that if we extrapolate this study of well-referred dentists, now I'm curiosity. This is only curiosity. It has nothing to do with dentistry, but I'm thinking in a way that people have traumatizing events in their lives, accidents, and bad memories while they were kids, or whatever. Do you think I'm extrapolating it right now. Do you think with your method they can actually accept those triggers and not be affected by them almost permanently?
Yes, that's exactly what I'm saying. Let's say somebody had a drowning experience, or let's say somebody has a problem with flying. They can't get into an airplane. They can't get into water because they had a drowning experience. This method can work on any previous trauma. Now, if a dentist decides to do this method in their office, it's best to stay with dental trauma. However, when you start clearing dental trauma, you may find that the original trauma was sexual abuse. Maybe it was something else. Now, before you need to go back to the original trauma and clear that, and clear whatever else comes up in that line of trauma. And dental trauma may be included in that line. But if, for example, sexual abuse, the original one, you have to clear that one too. It's like opening a box that has a box within it and another box in it. So with energy psychology, you open the bigger box of trauma, and then once that trauma is cleared, then you can gain access to the inside box. And
I understand.
Another trauma. So that goes on until you find the original one.
Yeah, because I really know somebody who, who had a bad experience while driving a car, and she had an accident or something. Now she's so scared of driving a car that she doesn't drive. Her friends, her family members take her everywhere, and she's so scared, even though she wants to buy a car, but for the same reason, because she's so scared, like a trauma. So that's why I was curious. Anyways.
Yeah, absolutely. That can definitely work on her.
Okay. Interesting. All right. Thank you for this question. Thank you for keeping up with my extra questions, by the way.
Oh no, they're wonderful.
All right.
Thank you.
Good. Thank you. So technically we are done here. Do you have anything, any other questions for me? Any other input for the whole thing?
No, it was just so great. I think it's so good using these questions in the last half, because it really does get personal, and kind of you get to know the person behind the recording. Yeah. So it's very nice. I appreciated it.
Yeah, I mean, I love that. I always love the second part of my podcast, because I get to know the person real, Before that, it's just more about, I do this, I do that, I go there, go, But, this is the process. But I think these questions open up. They really open up the person inside out. Mm-hmm. And that's when people get connected. That's what my thought is.
Yeah, Dr. Panks, do you think, based on what you know now, do you think that dentists are apprehensive at, using this method in their office on their patients? Do you think they would be apprehensive?
I'll be very honest, yes. Even though they have to be educated over and over, between you and me, for example, if Trump says, even though he lies, whatever, I don't know if you're a fan or not, but, something which is something which is spoken over and over, there are certain percentage of people who are always at the borderline, with a little push, with a little education, a little more education, I should say, I think people who are at the borderline will start accepting it. And then when they do that, and it becomes a relatively norm, for more people doing it.
Are you talking about like organizations in dentistry? Is that what you mean by people in the...
No, even dentists, even regular dentists. Like, for example, a random dentist who actually... Okay, I'm very open-minded. All right. I'm very open-minded, and I have, I've researched on psychosis. I've researched on really deep, questions. That's gonna be my next podcast, which is going to go up in next this by the end of this week or early next week. And I will certainly share it with you because I think you might be interested in that. I told you about Dr. Phil Borges. What I'm trying to say is I've researched about all kinds of podcasts, and I'm very being open-minded. I can still see where you're going with this. But at the same time, the dentists, the way they are trained, even you yourself would know, the way they are trained is they are very trained based on evidence-based dentistry or based on, all right, the PubMed said, this article said, this research said, so they are very left brains, logical people. And that's where, people who are just at the border of left and right is the one whom you can convert. And that will only be converted when they are being educated either through, regular Facebook live shows, what you can do, I would recommend, or putting on YouTube live shows. One of my friends, she was my assistant, and she started reading the cards, those tarot cards. And what she simply did was she talked to one of her friends and she started posting live videos for like 2 hours, maybe 3 hours, whatever her process of reading the tarots were. But because of that, some people got involved, or started watching those things. And I was one of them because she's a friend of mine, right? But logically speaking, that's nothing, right? But sometimes you need some help. You need some information which you cannot get. And then you reach out to the person. And then I did reach out to her because I wanted to ask a question. And so she read tarot cards for me, even though I did not believe in it. So what I'm trying to say is, in your way, I will call it as well-referred dentist method or Bita Saleh's method or, something catchy. I
feel it's the fearless way method. That's what it's called.
I'm sorry?
It's called the fearless way method.
Yeah, even better. So fearless way method, right? So like, for example, you got invited, you entered into my Facebook group. You can be actively involved whenever in a month's time or so, whenever I post your podcast. And then people would have questions and you can do a small webinar kind of thing and, just be available in short. Yeah, that's all.
I know exactly. Like be so that people get to know about it, hear about it.
Yeah.
And I hope I was clear that I actually teach this method to dentists through 8 weeks.
Yeah, I know. You were very clear about it. But also at the same time, I know we were discussing that a link that goes from my podcast to yours, and people will find you. People will find you, and especially when you've spoken about DrBitaSaleh.com, people will find you if they're really interested. But even then, so my people coming from my podcast to you would be few in number. Why? Because they have to be really, really interested to come to you to find it. So sometimes it's a good idea to expose yourself, advertise yourself, maybe doing some YouTube lives or Facebook lives, or what do you think you can do to talk about the fearless way method? Forget dentists, just fearless way method. Maybe you can come up with some other people who can be a part of you, like this, like I think this is what you just said. Can it be implemented on somebody else for other traumas, not only dental traumas, but other traumas? And I think that was a very good answer you gave. People would be interested to talk to you not as dentistry per se, but their own traumas or their friends or family's trauma, and then they will reach out to you for that. And I would say be open for that.
Include the public. Is it like include the public in it?
Yeah. People. There was another example I can give you. One of my friends, he's very open to me, and he hates his parents because of his, the way he was brought up. And he's a nice guy. His parents are nice. They're nice people, very hardworking and all. But for whatever reasons, maybe those kind of people can actually use your fearless way to kind of melt away, or at least reduce down the triggers. On the very similar notes, I don't know if you know about psilocybin, mushrooms. Psilocybin. It's a compound mushroom. It's a compound in mushrooms, which Tim Ferriss is actually sponsoring the study on John Hopkins, where psilocybin is considered to be reducing down the previous trauma and erasing the previous trauma pretty much completely.
Oh yeah, I've heard about it. That actually therapists are using that as a psychedelic method of bringing the person into the trauma and clearing it. Yeah, that's been very useful.
Yes. Yeah.
People like that. Okay.
People like that.
Okay.
Yeah.
Yeah.
All right.
So I'm very glad that Judy worked out, right? She's doing a podcast with you?
Yes. She sent me an initial reply, for which I replied to her. Finally, we are going back and forth to set up the times. I'm going to offer her a couple times in May to start. And I think I want to focus on the relationship between, as you suggested. That was a very good suggestion, by the way. Thank you. And then I'm going to research. I have 2 big podcasts coming up next week and the following week. So I am preparing for them. They're bigger podcasts. So and that takes much longer research, I should say. Anyway, so
you're busy. That's great. That's wonderful.
Thank you. Any other input? Any other suggestions for me?
No, you're doing great. I mean, you're very good at creating a safe environment, and I keep doing what you're doing. Awesome.
Okay. All right. Thank you.
Thank you so much for having me as a guest. And please let me know when it will air so I can promote it as well.
Yes. Yes.
And I look forward to hearing it.
Yeah, sure. All right.
Have a great day, Dr. Pang.
You too, Dr. Saleh. Thank you.
Bye-bye.
Bye. Do you like a particular book that you might have given? I think the question could also be paraphrased as, what is the one book that you love the most that you could have gifted somebody? Even if you didn't, that's okay. But
of course, yes. That's an easy question. The Power of Now by Eckhart Tolle. That book by itself, and I want to tell you why I think that book is amazing. Because I've started that book many times, and I couldn't finish it. I would just leave it after reading, 10 pages or whatever. But the one time that I actually did finish it and made a significant difference in my life, what Eckhart Tolle explains so well in this book, not just explains it, but also shows you how to do it, is to be present in the present moment. So 2 things that affect human beings are the past, the negative experiences of the past, or the future, unknown, the fear of the unknown in the future.
Right.
So those 2 can really have an effect on us. But when you're in the present moment, the past and the future is no longer of concern. So you're actually in this present moment where none of those worries and past negative experiences exist. And it's amazing. Like, sometimes I just have to remind myself that to be in the present moment, like literally look at the trees that are in front of me or touch the table that is in front of me. And that's really important for people who are fearful and anxious, is to be in the present moment, to actually bring themselves to the present moment. Noticing their breath, for example, noticing their hands, just anything that could bring them to the present moment. So this book is amazing. I highly recommend it.
Great. Yeah. Any other books that you like?
Oh, I love so many. I have a list actually on my website. So if you go on my website, it will ask you if you want my anxiety-free packet.
Yeah.
And all you have to do is say yes. And I have some supplemental material that comes up. One of them is books that I really like.
Yeah.
On energy psychology methods and other things. But yeah, definitely please go to that list. There's some amazing books. There's some amazing research that's done on energy psychology. So that's all there.
Got it. No, got it. Next is, what do people never ask you and you wish that they did?
It's more about people making it. I would love it for people to actually ask you or me how I feel and not make assumptions. I think a lot of people, including myself, I think we're so quick at making assumptions. And actually the book called The Four Agreements, that's a great book that touches on this subject, saying don't make assumptions. When, for example, somebody is going through grief, my dog passed away 6 months ago, and it affected me. It was the worst experience that I've experienced in my life. So grief is one of those situations where people make a lot of assumptions instead of just asking, what do you need at this moment? How can I help you at this moment? Like just asking how somebody's feeling and let them explain it to you is very similar to Teacher of the Heart, where you're just present for someone and you're not judging them, you're not assuming anything, you're just present, and you simply ask, how can I help you? How can I see you right now? To really truly be present, I wish more people would do that.
I was listening to another podcast on a similar topic. Can we actually see somebody without any judgment? I think it was Malcolm Gladwell. His podcast is what I was listening to. And he said, no, because we'll have to erase our memories in a way. But I get your point. It's like, and I also believe in a similar way. It gives a second chance, give a chance before judging somebody completely. And it's one of the hardest things to do, because I think we are wired, and we get wired in that way to start judging them in no time. That's what the human nature is. But as long as we are aware, even I think Malcolm Gladwell said the same thing, as long as we are aware that we might be judging them, we are able to give a second chance a little more easily. Am I making sense here?
Absolutely. Yeah, I think I would disagree that it's not possible. I think we can, but yes, it does require a lot of awareness of being in the present moment. And that's a very difficult lesson. That's a very difficult way of being, to be in the present moment and not pay attention to your own past experiences or this person who's sitting in front of you, their experiences. Like, it's very hard to not judge and just be there in the present moment. But I think it's doable.
Okay.
I really do.
Sure.
Yeah.
Sure.
But it's awareness and constant doing and being. So it's not just bringing yourself to the present moment, but just actually being present in that moment. really being. Like, it's not just about doing, but it's being in that moment.
So, if you could go back in your career or life and change one decision, what would that decision be?
I love that question. I can answer it very quickly, though. I wish that I had listened to my intuition when I got so much of it. And all the times that I did not listen to it, if I had listened to it, I would have reduced a lot of pain and suffering. I think that's the best way to put it.
You mean you're talking about your intuition, right?
Yeah, I'm talking about intuition. So if there's something that I could change in my life and do it differently, is all those times that I did not listen to my intuition, I wish I had listened to it.
I think I have to agree with that. As I said, I only started listening to my intuition only a year ago, so I'm no one.
all the previous times, there are so many. I would love to bring examples, but
do you think you can share something publicly?
Yeah, well, I'll give you one example. There was, it's very difficult to always be right in who you hire on your team.
Okay.
And because most of us are in private practice are solo practitioners, we really rely on our staff, and we should, because they're the ones that are there to support us. And sometimes when one person doesn't do that, and they actually even do some fraudulent activity that can really hurt us, those are the times that, for example, myself, I went through a long period of time where I had somebody that was doing fraudulent activity right under my nose. And I had a really bad feeling. I mean, to the point that it was every day. And on weekends, I would just sit with my stomach and, not knowing what was going on, but I had this awful feeling that something was going on.
Yeah.
And, but I didn't know. I just didn't know why I was feeling that way. And soon after 6 months to a year, I finally found out what was going on, and it was not good. It really, the pain and suffering it brought down on me was immense. And had I listened to that intuition, then I think I would have put measurements in place. I would have maybe hired a consultant and asked them to, do some digging and, find out what was going on. So, yeah, it's so important to listen to that intuition. So important.
Thanks. So, when you think of a person being successful, who comes to your mind?
Being successful, I think, comes to mind. I think it's every dentist, every doctor who goes to work and shows up to work every day to see patients. That showing up and being willing to help somebody, that to me is success.
Okay.
It's not how much money you make. Of course, that is good and it needs to be there. But successful people are those that don't let adversity stop them from the path that they want to follow. And despite all the difficulties, they still get up and they still show up in their practice and they still do what they love to do. Those are the successful people. At least that's my definition.
Yeah. The best purchases, any purchase that you made between $100 to $300 that impacted your life in a positive way.
Between $100 to $300. Yeah, that would be, well, I wish it was $100, $300. Intraoral camera.
Okay.
I think that, but let me tell you why I say that. When I purchased my practice. It was a small practice. A doctor had been there for 30 years.
Mm-hmm.
And, I thought, okay, as a new dentist, I had no idea what to look for. So on the first day that the keys were handed to me, a patient walked in with her crown in her hand, a crown that had been cemented a week ago.
Yeah.
And she was upset, clearly, because the crown had fallen off. And when I looked at the tooth, there was hardly any tooth structure above the gum line. Mm-hmm. That was the beginning of me realizing that this dentist had been pretty much doing supervised neglect for who knows how long.
Okay.
But now, we hear about supervised neglect in dental school. We hear about it, but no one tells us what to do to get out of it when it's been handed to us by somebody else.
Mm-hmm.
So here I was, he had mostly older patients, and what I found in these patients were, it was upsetting, just really upsetting.
Got it.
Things that should have been diagnosed that were not diagnosed, open crown margins, and the list goes on. And these people all trusted him because he had established trust with these patients. However, I was a new dentist and I didn't know about trust. And I did not have an intraoral camera. So what they did when I told them that things were failing in their mouth, instead of believing me, they just thought I was milking them dry of their money.
Yeah.
So they left my practice and they never questioned this dentist who had actually created those problems.
Right.
So I lost about half of my practice just with that. Had I had an intraoral camera, I would have been able to take that and show the patients, that there was a through and through decay under their crown.
Okay.
And I could have shown them a lot of that, and seeing it, they may have believed me instead of not believing me. So that's huge. I think intraoral camera, every new dentist needs one. Every new dentist.
Mm-hmm. What is one advice that you would give to yourself, to younger Dr. Bita Saleh? Like, for example, you're 30 years old, 40 years old, 50 years old, whatever, I'm just making up the numbers here. But the idea is your younger self, advice to younger self.
I would say trust your intuition. I mean, that is like the Bible for me. I'm so intuitive in that now that I know how my intuition, I should have trusted it. And now that I know that, that's what I would tell my younger self. Like, the minute you get that intuitive whisper, trust it instead of not trusting it and not going after it. Like, trust that like it's the Bible or whatever you believe in.
If you have a giant billboard such that you could display a great message or a quote for everyone to follow, of course, not about your book, what would you like to tell people or the dental world?
I would say don't do it alone. Ask for help.
Okay.
And the reason I say that is because, our training, when we're training to get into dental school and while we're in dental school, there's a lot of competition. And rightfully so, especially for those people who want to specialize, they have to, be very competitive. And then, we have that competitive mindset. And then when we get into private practice, then all these problems exist that we're not trained in. We're really good dentists, but we're not trained in the business part of it. But the society, and everyone expects us to know everything. After all, we're doctors, we should know it all. So there's this expectation that society has that, well, you finish your training, now you can be successful and provide for your family and retirement because you know it all. And we get into this place where we're like, well, I really don't know. I failed at this, like I failed at that. What do I do? But then, you're faced with this belief that you should know it all. So we're always very careful not to ask for help because why? After all, we're supposed to know it. And that is wrong. We can be good at dentistry. We can be the best dentist, but from office, practice, business management, we need to be able to reach out and ask people who are an expert in those things to help us. We can't do it alone.
Got it.
So that would be my message is, of course you can do it alone. Dr. Pence, don't get me wrong. I mean, we can all figure it out, right? But the road is going to be a lot harder when we do it by trial and error. It's going to be a lot harder than if somebody is guiding you.
I agree with that. Clearly agree with that. One thing that you're excited about, one thing that you've changed your minds on, and one thing that you do that is absurd or funny. So let's start. You can do one at a time. One thing that you're excited about.
One thing I'm excited about. I'm really excited about the Fearless Way method, which is discussed in my first book. I really would love to see every dental office do this because it's going to change dentistry. It's going to change the patient's life. It's going to change the dentist's life.
Right. Got it.
And that's one thing that I'm really excited about. The next is changed your mind on.
Yeah. Something that you believed in wholeheartedly, or whatever, initially you believed in something and now doesn't seem right. And, either because of experience or somebody told you something else that changed your minds on.
Yeah. I have a very independent streak in me, and ever since I was 14, I left. I was in a boarding school and then in another country, and then so I've been on my own since I was 14, and therefore I have this very independent side to me that I always thought I could do everything myself. So it kind of ties back to that previous question. I thought I had endless energy, and that I never even considered that my body could change as I aged. So all those things that I thought I would never have to ask for help. So if I could change that belief when I was, from younger, I don't know. It would have. I don't know. I mean, if it would have changed my life in any way, but I think just the belief that I'm going to be doing this forever by myself and everything will be fine. I wish I didn't, because when it was no longer true, I had a lot of adjustments to make.
Got it. But I think this is all about dentistry in general. We have to give permission to ourselves. It is okay to ask for help. It is okay if you don't know the answer, because, and that is the reason I started the podcast. I don't know so many questions, so many answers, but the whole idea is if I learn one thing from one person and that changes me and I adapt on it, it's okay. So I'm trying to say the same thing. Dentists, we usually are very hell-bent in that regard, saying we know everything, and we don't ask for help because apparently we should know everything and we know everything, but it's not true. Not everybody can know everything. So it's okay. I think we all have to give permission to each other and not judge at the same time if somebody's asking for help. If I ask help from my own assistant, hey, I don't understand how you do this, it is okay. I think that is really okay. Go ahead and ask for it, because Now you know better, right? I think we
Absolutely.
all have to give permission to each other. It is okay.
Yeah, and it doesn't mean that if you ask for help that you're weak somehow. You know, I was
Exactly.
I was talking to a client who's also a physician, and she had the same. I mean, I think medical school and dental school are the same, in that if you ask for help, you're going to be perceived as weak or, you know, not up to par somehow, and that's so far from the truth.
But also it is because how you have presented yourself in all these years that you know everything, and immediately you asking for help seems a little out of track or odd for somebody. And then you've already created a bubble which is going to burst one way or the other. But it's just a matter of when, right? If you ask it early, you know, you can burst the bubble right now and you know, be vulnerable. I think being vulnerable is the quality. It's not a weakness. And we all should be vulnerable, and it's okay. It's okay to be wrong. It's okay to understand that, you know, you can ask questions and give permission to each other to ask the questions, even if you don't know, or you believe, right? Okay.
It's actually a sign of courage to say, hey, something's not working well for me.
Yeah.
Who do I ask for help?
Right.
You know, just that requires a lot of courage, like you said, just to be vulnerable and say, I'm stuck. I need help.
All right. So last question. One thing that is really absurd or funny that you do.
Well, I do tend to laugh about a lot. There is a part of me, it's the comical part, that I think always makes fun of all my experiences and laughs about them. That can kind of keeps me sane.
Yeah.
But yeah, I don't think I do anything that, you know, brings laughter for me. I think it's just my thought process. I don't know if you've heard of internal family systems. It's based on the belief in psychology that our psyche is made up of different parts. So I have a part in me in my psyche that is so funny, and it looks at, you know, experiences that I've had in the past and makes a comical version out of it. And of course, it happens after it's happened. And that comical version completely changes the picture. And just by laughing at what happened, it kind of removes the negative experience. And of course, comedy is a higher energy than, you know, sadness. So it immediately transforms and takes me to a higher level of energy about that experience. So I think it's so important to be able to laugh at, you know, at yourself and all the mistakes that you've done, and just laugh about it, because, you know, nobody has all the answers.
Yeah.
We're all just learning. You know, it doesn't matter how many years you've been in practice. You know, just every time I said to myself, oh, I think I've seen it all, then guaranteed something else would happen that I had never seen before happen. You know, it's just endless.
Well,
like, we're all here just learning.
Well, I call that as dental gods wrecking their heck, you know. So, so yeah, I call them as dental gods wrecking their havoc, you know. And that is true. You know, someday, I was talking to Dr. Kirk one day, interviewing him, and we said the same thing. And he's a surgeon. He does extraction all day long, you know. And, you know, one day you think this is easy. That's it. That's the one which is giving you the most trouble, right? Thank you. Thank you for coming in today.
Oh, thank you for asking. Thank you. This was fun.
Yeah. Thank you.
Thank you, Dr. Banks.
Yeah. Thank you. Thank you for coming in again.
Thank you. Have a great afternoon.
Yeah, you too. All right. Bye.
Bye-bye.
Would you like to get a really small email a couple times a month to see what hashtag POD is up to? What are we reading? What are we listening to? What are we doing? What's stupid, funny, entertaining, and some weird stuff that we've gotten ourselves into? Then go to podcastsofdentistry.com/extra. EXTRA. That's right. Podcastsofdentistry.com/extra. And you will get a really small email from us to give you that little extra kick and keep you busy exploring the world we travel. You can also find us on Facebook at podcastsofdentistry.com/Facebook. Thank you for listening. Hashtag POD. And I'll see you inside.